Hi, everyone. This is Steve Johnson. Just wanted to provide you with some clinical updates for UW Stevens Point's Doctor of Physical Therapy program. As some of you may already know, I am the Director of Clinical Education, was with the founding faculty that started this program, and believe it or not, we continue to progress and getting ready to admit another cohort coming up here at the end of May. So for the clinical education updates for 2026, I'm going to talk a little bit about accreditation, as well as a few program updates, and then a small update related to CPI 3.0, as well as some clinical education information. And obviously this is a video, so we won't have any in-person questions. However, certainly we'll provide contact information that you can reach out to the program with your questions as you have them. So on the good news side of things, the program received CAPT accreditation at the spring meeting in 2025. I believe that information may not have officially been part of our presentation last year, but we were anticipating accreditation. We were successful. We did have to provide a follow-up compliance report with additional information on our graduates, because at the time of the decision, our graduate survey, we had not planned on sending out our graduate survey until 6 months after graduation, and so that information had not been collected yet. We have since provided that compliance report, and our anticipation is that we will be fully accredited following the release of information from the spring CAPD meeting. Often folks are interested in knowing about our graduate outcomes, and so we graduated our second cohort here in December, and we have some exam pass rate data that we're sharing, realizing that not all students have attempted the exam yet from our 2025 cohort. And so our preliminary results that we have to report, our 2024 cohort, we have a 94% ultimate pass rate from that group of 32 students. We have 30 out of the 32 students who have passed the exam. Our 2025 cohort, not all students have attempted the exam yet. Some are going to wait until the April exam date, and we do not have those results yet. However, what we do have is students who took the exam in October, as well as students who took the exam in January. And based on those results, our first-time pass rate for our 2025 cohort is 96.3%. So just as some benchmarks, the national average for first-time pass rate is 85%. And so our 2025 cohort significantly surpassed that 85% mark. And the national average for ultimate pass rate hovers at around 97.5%. And so I think that ultimately we will come in at or above both of these benchmarks as the ultimate exam results continue to come in over coming years. Again, for those of you who may be learning about the program or newer to our program, we are a competency-based curriculum. We certainly teach in a traditional design of having classes like neuro and musculoskeletal and cardiopulm. However, what we also do is a competency-based skill portion when it comes to lab-related activities. And our students complete a set of competencies that are given to them at the start of each term. And those competencies, they're allowed to progress at their own pace, with the idea that we do put some guardrails in place to make sure that the students are moving along at a pace sufficient for them to complete the required competencies. And we also use case-based guides to help give context to what the students are doing. As way of example, in one term, the students are looking at upper extremity. They're learning all the muscles of the upper extremity. They're studying the range of motion. They're studying the muscles. They're studying special tests. And so after the students have completed all of their basic skill checks, they will then have to schedule with a faculty member to complete a case that is essentially some type of shoulder condition or elbow condition that it is based off of the upper extremity, that gives context to the materials that they're learning about. Second thing about the program that is a kind of a unique structure is that we truly focus on an integrated clinical practice during the didactic portion of the program. And so for each of the first 6 semesters that the students are in the program, they are spending 2+ hours per week in a clinical environment, and they rotate through those areas each semester that they're in the program. And some of the examples of what we have the students doing, we have a promotional clinic at the YMCA that sees patients through a traditional model. Think general outpatient orthopedics. We have a 3D motion analysis for running and gait that works with folks that need gait analysis. We have a relationship with the Special Olympics and work with Special Olympians for an entire semester and help develop plans of care that help them with range of motion, flexibility, strength, as well as avoiding injuries for their preferred sport. In addition to that, we have a relationship with the ADRC and focus on geriatric fall prevention, gait and balance assessments, and follow-up intervention meetings with those clients as well as a relationship with a local hospital system where we place students in higher complexity acute care type of environments. As part of that integrated clinical practice sequence, we have the students working in small peer groups for learning support, as well as pairing second-year students with first-year students so that the second-year student is really at the point of developing plans of care, completing evaluations, while the first-year students are really much more in a rudimentary development of just basic skills. Can you take range of motion of this joint? Can you muscle test and come up with some very basic questions for the client? Some program updates related to faculty. Unfortunately, we've had a couple of faculty who have decided that they would enjoy retirement more than continuing to teach. And so Chris Durall announced his retirement and ended his work with us in December of 2025. And Tim Helkowski announced he's also retiring and is going to be stepping away at the end of the summer term this summer. So with that, we're sad to see them go. They will be greatly missed, but we are also very fortunate that we were able to hire 2 new clinical faculty into roles with our team. Justin Rosinski and Joel Mizgalski will be joining us this summer, and we look forward to having them help us with our didactic preparation of our students for the clinic. CPI updates. For those of you who haven't taken students in a while, please be aware that there is a CPI 3.0, and that has a required training that you can get to through the APTA website in the learning modules. And just make sure that you're careful to select the appropriate learning module and that you don't take the CPI training for the student or the DCE. Make sure you take the training for the CI. And understand that until you do that training, CPI basically blocks you from setting up an account. So it's sort of their way of policing that everybody does the orientation to the new module. On a good news front, for those of you who have been using CPI 3.0, they have now developed a mobile app, and there is a guide for the mobile app that'll be available in the APTA user community resource library, as well as know that you can go out to either the Apple App Store or the Google Play Store and get the CPI 3.0 mobile app. once you have that loaded in your mobile device, you can then log into it wherever you are with your mobile device and have cell reception. Some key dates for 2026 and 2027. Clinical internship 1 starts on May 12th, ends on August 21st. Clinical internship 2, August 31st to December 10th. 2027, you'll see an asterisk. These are the proposed dates. We do have some conflicts related to the late start to the spring semester and the Labor Day timing. This particular academic calendar, we may need to shift those dates slightly, but know that there won't be any significant changes. We will have a summer clinical internship and a fall clinical internship. Again, expectations of our students. This is their terminal clinical placements. Our students have had 6 semesters of integrated clinical practice. They are ready for their terminal clinical internships. And the students are expected to be functioning at what I would say is an intermediate to advanced intermediate level in most environments with uncomplicated clients. The students are required to be at entry level prior to completion of that second clinical internship. Our goal, as always, is to consistently place students with clinical sites. Our goal as a program is not to develop 1,000 clinical placement locations, but to develop a set of consistent partners who are familiar with us and we are familiar with them, and happy to place students with them whenever we can. We do require 1 high acuity placement. Think acute care, SNF, rehab hospital, home health, and we do require the traditional outpatient placement. At least one of those placements must be in a rural or rural adjacent environment. And for those of you who might be interested, because of how our students learn, they are quite prepared to learn in a collaborative model. And so if your clinic has talked about or wanted to explore the idea of the collaborative clinical education model, I am experienced with it. I am happy to talk about it and can certainly work with your institution to explore pathways to having a 2-to-1 clinical model. If you have any questions about this presentation, or if you'd like to just reach out to me, here's my email address, as well as just contact the program directly. They will forward your information to me. But we always extend an invitation to any of our clinical partners. If you take students from our program, we would love to have you come and see our spaces. If you know that you're going to be in the Stevens Point area, get a hold of us ahead of time. We will make sure we set up a tour for you, give you a chance to see our program. And with that, I will say thank you. As I always do, I am blessed to work in the state of Wisconsin and to work with clinicians who care so deeply about the profession of physical therapy. And I am wise enough to realize that we would not have a physical therapy program if it wasn't for you great folks out in the clinic that help us each and every day develop our students into clinicians. And with that, I will end the presentation and thank you and hope to see you when I'm out doing clinic visits.